Hello everyone, this is Group 2's presentation on Afaf Ibrahim Meleis's Transitions Theory. This presentation is by Abigail, Hasheen, Julia, Michelle, and Neha. Transitions theory emphasizes transitions as a central concept of nursing. A transition, as defined by Meleis, is a passage of movement from one state, condition, or place to another and is triggered by change. Transitions theory provides a comprehensive perspective on transition experience while considering the context within which people are experiencing a transition. As nurses, we will be constantly caring for people going through transitions affecting their health. The presentation outline includes types, patterns, and properties of transitions, transition conditions and patterns of response. Then we will discuss nursing therapeutic interventions during the transition process. And for the last part of the presentation, we will be focusing on the role of the nursing meta paradigm in this theory, its application to nursing practice, as well as its application to the CNO's entry to practice and ethics guidelines. This diagram outlines the key components of the transitions theory that we will be addressing in our presentation. Just before we begin with the main content of the presentation, we want to introduce this case study to the class. We will be analyzing how this case study represents different aspects of the theory and will be referring back to it throughout the duration of this presentation. We also have an animation that is linked in our section for you to check out. This will be our creative component. Amelia is a 29-year-old woman with no previous health conditions. She has been married for 5 years and recently delivered her first child, a baby girl. Amelia had a vaginal delivery with no complications. She was discharged from the hospital 24 hours after the baby was born. She was mostly active, upbeat, and cheerful during her pregnancy. She gave birth to a healthy 7-pound baby girl. After the delivery, she started to feel sad, anxious, overwhelmed, and tearful. This feeling persisted for the first 12 weeks since delivery. Amelia planned to exclusively breastfeed her baby, however, experienced some unexpected difficulty. She started to have trouble during the first few nights at home with getting the baby to latch during nursing and didn't want to give her formula. She had limited support. Her parents are living in another province. Her in-laws were much older and couldn't help regularly. She felt overwhelmed with all of her new duties as a mother and was having trouble with not getting enough sleep at night due to nighttime feedings. Amelia's husband tried to be supportive, but also felt overwhelmed by all of it. He felt she was inconsolable, and they both felt isolated. Both Amelia and her husband felt unprepared for life with a newborn. Amelia was caring for her newborn while still going through the healing process herself. Now, keeping in mind Amelia's situation, as nursing students, I would like us all to think about how certain details are relevant to consider. Transition types. The types of transitions that the theory addresses are developmental, situational, organizational, and health and illness. Developmental transitions are stages in the life cycle. This includes birth, adolescence, menopause, aging, and death. Situational transitions refer to changes in the client's environment and their living conditions. The transition from living at home to moving into a long-term care center is an example of a situational transition. Organizational transitions are changes within the healthcare environment that affects patients and workers within the system. An example of this has been demonstrated with COVID-19 protocols, with mask wearing, limits on visitors, and overcrowded ICUs, just to name a few. Health and illness transitions are changes in one's health. This also includes sudden acute illness and the gradual progression from wellness to chronic illness. Next, we will discuss transition patterns. Meleis describes different patterns for transitions, which can be split into single or multiple, sequential or simultaneous, and related or unrelated. For single or multiple, how many transitions are happening at the same time? One or more? Sequential or simultaneous? Are the transitions right after each other, or are they happening at the same time? Related or unrelated? Are the transitions happening because of each other, or are they not? Most people will experience multiple transitions simultaneously and are often connected to each other. Let's think back to the case study. Amelia was experiencing multiple transitions at once. She was dealing with a situational transition from the hospital to home with her new baby, as well as a health and illness transition as she was still healing from giving birth. Not only those, but she was also experiencing a developmental transition. Both of these transitions were also happening simultaneously, and Amelia had to adapt. In her case, her healing process is related to her transition home. At home, she does not have professional patient-centered care. She has to rely on her own health knowledge and has less support from hospital staff. If she were to stay at the hospital, she could focus more on her healing rather than both her healing and her baby. Transition theory has 5 distinct properties that are essential to the transition experience. These properties function in an interrelated way, meaning that all 5 properties impact and influence each other. The 5 properties, as per Meleis, are awareness, engagement, change and difference, transition and time span, and critical points and events. Let's take a deeper look at each property individually. Awareness, as defined by Meleis, is the perception, knowledge, and recognition of a transition experience. This indicates that a person is conscious of their own transition and can recognize that one is occurring. When a person is unaware of their own journey through a new transition experience, it is possible that the person has not yet begun their transition, but it's important to remember that this is not always the case. Engagement is the degree to which a person is actively involved in their own transition and actively engages with components related to their transition experience. Awareness and engagement are directly related and are interconnected. Meleis explains that there is no engagement without awareness, as one cannot actively participate in something that they have no comprehension of. As described by Meleis, all transitions are said to be associated with change. However, it is important to note that not all life changes leads to transitions. Only significant changes that are impactful to the individual cause transitions. Changes can occur in multiple avenues of life, including in personal identity, life roles, relationships with others, and in physical and psychological abilities. A change in identity indicates a change in a person's self-perception. Some common examples include discovering one's sexual orientation or a change in gender identity. Changes in life roles can include becoming a new parent, switching career paths, or, as we will soon be doing, entering the workforce as nurses. Meleis further argues that changes in life are brought upon by challenging differences. Challenging differences, according to the Good text, can occur through feelings of unsatisfied or atypical expectations, feeling dissimilar, being realized as dissimilar, or viewing the world and others in dissimilar ways. A transition is a span of time with an identifiable starting point, extending from the first signs of anticipation, perception, or demonstration of change, moving through a period of instability, confusion, and distress, to an eventual ending with a new beginning or period of stability. Transitions in time span thus coincide, as transitions are said to flow continuously throughout time. Important to note here is that creating an expected time frame for the duration of a transition can be problematic. Insinuating that a transition should only occur for so long can create a sense of prejudice towards those who fall outside of the allotted time span. It is important to remember that transitions are unique to individuals and should thus be understood on an individual level. Relating back to our case study with Amelia, it is important to remember that the transition into parenthood is not only extremely challenging, but also very individualized. The time it may take for Amelia to adjust through her transition may be very different compared to someone else. Neither parent should be made to feel bad about their duration of time and should instead be treated on an individual level, where their specific needs can be catered to. Finally, critical points and events are occurrences in life that are distinct or are a marker for change. Transitions in life usually, but not always, have specific markers or points that catalyze a transition period. The textbook gives the examples of birth, death, cessation of menstruation, or the diagnosis of an illness. The birth of a child is a critical point where the life of a person begins and parenthood also starts. Death, in contrast, marks the ending of a life and can be a catalyst for a life transition for those who are close to the individual. The diagnosis of an illness marks a change in life course expectations and can alter one's self perception from being a healthy individual to one who is now ill. I encourage you to think of some critical points and events that may have occurred or are currently occurring in your own life. Moving forward, transition conditions refer to personal, societal, and community conditions that facilitate or inhibit the individual transition process. Personal conditions include meanings, cultural beliefs and attitudes, economic status, preparation, and knowledge. Meanings refer to the individual's subjective appraisal of the event, where positive meanings tend to be associated with more healthy transitions. Preparation and knowledge refers to the individual's anticipation and awareness of the transition process, where lack of preparation and knowledge tend to be inhibitors of transitions. Community conditions refer to the accessibility of resources, where a lack of resources can inhibit an individual's ability to achieve a healthy transition. Finally, Meleis illustrates societal transition conditions through the marginalization of immigrants that occurs in the host country. Marginalization leads to social, economic, physical, psychological, and physiological deterioration that eventually results in poor health outcomes. Patterns of response. Observing the behavioral patterns of people in the transition process allows us to determine whether a transition is healthy and aids in guiding nursing interventions to ensure the best possible outcome. The goal of a healthy transition is to master behaviors, sentiments, and cues associated with new roles and identities. Essentially, it is a smooth transition. Healthy responses are characterized by process and outcome indicators. Process indicators direct clients towards either health or risk, allowing for early assessment and suitable interventions to obtain healthy outcomes. The driving forces of process indicators are the need to feel connected, interacting with the environment, being situated, and development of confidence and coping. The need to feel connected is a networking tool used to obtain information, housing, transportation, employment, and social support for the client. Feeling connected to healthcare professionals also allows for building rapport and increased comfort with consulting them. In Amelia's case, we can see that she does not feel connected to social or kinship networks and therefore does not have much access to reliable resources. The lack of connections moves her towards an unhealthy transition response. Interactions mainly refer to strong client and caregiver communication. Through interactions with the client and caregiver, we can identify the next steps to take towards a mutually beneficial transition experience. They can clarify, acknowledge, and work towards developing effective self-care and caregiving. Being situated or one's familiarity with their location allows for a healthy transition. This is evident in new immigrants as they make constant comparisons between their home and host countries. They are a way of helping people understand where they are, who they are, and why they are here in terms of time and space. Acknowledging the contrasts and similarities between two different places allows them to process their transition. The development of confidence and coping is an observable indicator of a healthy transition. Specifically, it is the progressive increase in confidence and coping of their transition experience over time. As a first-time mother, Amelia's confidence will have to be built over time. She is having an unhealthy transition because over the period of 2 months, there is no increase in her confidence or coping as a parent. Outcome indicators are observed at the end of a transition to determine whether a transition was healthy through mastery of skills and integration of new identities. It is important to determine the completion of a transition because if an outcome is observed too early, it is a process indicator, and if it is observed too late, it may be related to other events in the client's life. Mastery. A healthy completion of a transition is determined by the extent of an individual's mastery of skills or behaviors needed to manage their new situation. It is a result of previously established and newly acquired skills. Mastery is indicated by stability in one's new role. We know Amelia has not yet gained mastery of her parenting skills as she's anxious and overwhelmed. However, we don't expect this response as her transition into motherhood is not yet complete. Fluid integrative identities. Transition experiences force individuals to question, develop, or reform their beliefs, values, and identities. Identities are a fluid concept that are constantly undergoing change. Being placed in new roles allows individuals to integrate their previous identity into these new positions. A healthy transition is indicated by successful integration. Nursing therapeutics are defined by Meleis as 3 measures that are widely applicable to therapeutic intervention during transitions. The assessment of readiness is an interdisciplinary effort and based on full understanding of the individual client and requires assessment of each transition condition to evaluate the client's readiness for the transition. Preparation for the transition, a suggested nursing therapeutic, and includes education as the main method of generating the best condition to be ready for a transition. The third measure is role supplementation, which involves conveying information to role incumbent or significant others to full awareness of behavior patterns. This was proposed by Meleis in 1975, but no further developments were made to the concept in the middle range theory of transitions. Moving on, we will now relate the transitions theory to the nursing paradigm and how it fits into each concept of person, nursing, environment, and health, and then apply it back to the case study of Amelia. Throughout their lifespan, a person will go through multiple transitions. As individuals go through these transitions, they experience changes in their identities, roles, relationships, abilities, and patterns of behavior. Applying this to our case study, Amelia experiences changes in her identity and behavior after giving birth, where she persistently felt sad and overwhelmed. She experienced role changes as she became responsible for taking care of a baby, which further influenced her relationship with her husband. The concept of nursing involves assessing client readiness, preparing the client for transition through education, and engaging in role supplementation to ultimately provide supportive care in transitions. Applying it back to our case study, the nurse in this role would be assisting Amelia in transitioning into motherhood. The nurse would assess Amelia's readiness to transition, then provide Amelia with information specific to her needs, which may include information on postpartum depression or guiding her in obtaining a proper latch. The individual's environment is influential in determining the success of an individual's transition. For Amelia, this could be her home environment where she lacks support as her family lives in another province. And finally, health. Transition theory defines the concept of health as a mastery. This includes a mastery of behaviors, sentiments, cues, and symbols associated with an individual's new roles and identities in the transition process. Moreover, health is complex and multidimensional, such that individuals may experience multiple transitions simultaneously and therefore will have complex identities of health. For Amelia, a healthy transition may include breastfeeding her baby using proper latch techniques, managing her postpartum depression and anxiety, or effectively co-parenting with her husband. Next is the application to the nursing practice. Meleis's transition theory has been applied extensively to research studies in order to use research-based evidence to inform policies involving transitions. We will be looking at 2 aspects of the theory to understand how they aid nursing practice. The first theoretical aspect is preparation. Preparation can be applied to nursing practice by educating clients and empowering them to have the tools needed to continue to care for themselves in their daily lives. Client education is the most effective method of preparing clients for transitions. Based on a qualitative descriptive study asking parents what they were concerned about regarding discharge of their infant from the NICU, 5 thematic categories of responses emerged: informational needs, anticipatory grief, parent-child development, stress and coping, and social support. The research indicates that there is room for improvement in the preparation aspect of nursing to mitigate parental concerns regarding their infant's discharge from the NICU. Another aspect important to nursing practice is role supplementation. Role supplementation is a way to enhance a healthy transition and decrease role insufficiency. In any transition to a new role, there is usually the feeling of inadequacy involved. As nursing students, we may often encounter such feelings of anxiety, frustration, and powerlessness. We can use role supplementation to help us navigate and try to dissipate those feelings. This is true for any role or any transition, including our future transition from students to novices to experts, as mentioned in Benner's theory. To see how effective the transitions theory has been in practice, we will briefly talk about a study conducted to reduce 30-day hospital readmission rates using a combination of the transitions theory and best practice guidelines, known as the transition management model. The study assessed clients' critical properties through screening tools, then identified barriers to their care, and finally used nursing therapeutics to provide a healthy transition. They then observed the responses to check for mastery and fluid integrative identity indicators for healthy transitions and reported their findings. As a result of the study, there was an 11% decrease in 30-day hospital readmission rates, as well as improved patient health outcomes and an estimated 1 million cost savings. This study is an ideal example of how transitions theory can be applied to improve nursing practice. We will now be using the transitions theory and comparing it to CNO entry to practice competencies. This document outlines 9 roles which a competent nurse practices in. One of these roles is the role of a clinician. A clinician is one who provides safe, ethical, competent, compassionate, client-centered, and evidence-informed nursing care across the lifespan in response to clients' needs. A nurse operating from a transitions theory perspective engages in client-centered care when he or she is assessing the client for readiness and engaging in role supplementation. The nurse assists the client by identifying where the client is at in the transition process and begins from there. The nurse then educates the patient on evidence-based information that is unique to their transition process, while considering extraneous social, cultural, and political conditions that may influence the patient. In the case of Amelia, the nurse could utilize the transition questionnaire aimed to measure concerns and perceptions of mothers of newborn infants. The questionnaire consists of 4 parts: identifying maternal concerns and perceptions, identifying informational needs and available support, identifying any concerns related to discharge, and identifying general demographic information that may facilitate or inhibit the mother's transition process. Assessing these factors are important in healthy maternal transitions, as researchers found inadequate education and communication can have resulted in increased healthcare costs due to potentially avoidable complications and rehospitalizations. Specifically, up to 27% of healthy infants are readmitted to the hospital, with majority of readmittance occurring in the first 2 weeks. This exemplifies the importance of using evidence-based practice to effectively assess clients' needs so that nurses can engage in their role of a clinician and provide safe and competent client-centered care. The CNO ethics document goes into depth about ethical values and how they are important to nursing. Along with these ethical values, there are behavioral directives that help nurses navigate through ethical situations. The ethical value client well-being describes the behavioral directive using their knowledge and skills to promote clients' best interests in an empathetic manner. According to the CNO document, promoting client well-being means facilitating the client's health and welfare and preventing or removing harm. As it relates to Meleis's transitional theory, it is important that as a nurse, we provide information and our knowledge to help guide the clients and their families through different transitions in an empathetic way. Even if the transition does not align with our own values and views, we need to decipher what is best for each individual client and give them the necessary resources and knowledge to help them through the process. That concludes our presentation on Meleis's transition theory. Thank you for listening. Our group will be happy to answer any questions during the scheduled question and answer session. We hope to have an engaging discussion with all of you.